Hello Hilary, welcome to Force. Would you mind introducing yourself please?
My name's Hilary Mitchell and I work as an associate specialist in oral and maxillofacial surgery in a local hospital here. I've worked in the specialty of oral and maxillofacial surgery for about 20 years, but as an oral surgeon, so I'm involved with patients who have problems with wisdom teeth and buried teeth and lumps and bumps in their mouth. I do some surgery. I'm peripherally involved in head and neck cancer screening, so I will see patients who might have been referred to see if they've got a mouth cancer and perhaps in biopsying cancer. But the most part of my job is not that, it's seeing patients with problems in their mouth that might need surgery, and I've done that for about 20 years.
We're making this film today for medical students that come to Force. Would you mind just telling me a little bit about your cancer diagnosis?
I had a tonsil carcinoma which had spread to the lymph nodes in my neck, but it was diagnosed, I just had a lump in my neck, painless lump, which couldn't really explain. So I asked originally a colleague from my department, and very quickly they identified that the lump in the neck was a malignant lump, and they knew it had come from somewhere in my head and neck region, but I had no signs or symptoms of disease. So scans didn't find it, and I had my tonsils removed and other biopsies, and they found it was a tonsil tumour, and these tumours very commonly present with a lump first of all. Obviously it was an enormous shock. You know, I'm used to seeing patients who sometimes have lumps in the neck. Usually I'm just looking in the mouth, but as part of our department we do see patients that present with lumps. But it never really occurred to me that I actually might have a head and neck malignancy. I've worked in that sort of specialty for so long on the periphery as an oral surgeon. So it was shocking, unbelievable. I think anybody who has a cancer diagnosis can't believe it. But to find it was actually in an area that my own department was involved with, and I saw patients with similar diagnoses, not identical, because I went to ENT, was sort of stunning. And you know, looking back, it was traumatic, as it is for any cancer patient. And you just get onto that the sort of conveyor belt of, and it was very quick investigations and results coming through, and just trying to get a final diagnosis. Now your tonsil's out, and now here's the result, and we're moving you on to treatment very quickly. So much going on in a very short period of time, and everything sort of seeming very shocking. And oh yes, and it's this stage, and you'll have this treatment, and then you'll need to see so many different people in the run up to treatment. I mean, we often say you're like a rabbit in the headlights. It's just a period of time in your life where you don't have time to stop and think and go, okay, it's just a roller coaster. You're trying to decide how you tell your family, what you tell your children, do you email your friends? You are just doing as you're told, nodding, taking the information, going home, trying not to fall apart, trying to put a smiley face on for your children. Oh, I'm sure it'll all be fine. And trying to sleep at night, which is a huge problem.
Could you tell me a bit more about your treatment, and specifically about the psychological impact of going through cancer treatments?
Cancer treatments are different for every cancer. For this sort of oropharyngeal malignancy, the treatment is 7 weeks of combined radiotherapy and chemotherapy at the same time. It's described as brutal treatment, and I would say that's an understatement. It's a huge challenge to get through it, and some patients don't manage to have all the treatment or all the chemotherapy because of the effects. And the teams and the doctors and all the nursing staff, they prepare you very well. They carefully try to tell you that it's going to get very difficult, and they're specific about swallowing. But it's difficult with this kind of intense treatment to really prepare patients, because there are so many things that are going on and so many potential side effects. Chemotherapy's got all the side effects that mount up. The radiotherapy has. You put the two together, and you know, what's any individual patient going to get? But it was 7 very challenging weeks. The most telling thing for me was when they were quietly insisting that I needed to have a feeding tube, a PEG feeding tube put into my stomach, because I would not be able to get enough nutrition in by the end. The mask that you have made for head and neck cancer radiotherapy, quite claustrophobic. Every day they clamp you into the mask. You get used to it, but the first few sessions are very stressful. Everybody leaves the room. The lights, you see the machine. It's a slightly terrifying experience. I've spent a lot of time in hospitals, and hospitals don't bother me at all. They feel like second home to me. But I found each bit of the treatment hugely challenging psychologically. The MRI scan was really stressful. The treatment itself, yeah, very challenging.
Yeah. What would be really helpful to know is, because of your personal cancer experience, how that might have affected the way you practice professionally now.
It's very difficult to be specific and say, oh, I do this different. But I know that unconsciously I listen more. It's not because of the cancer treatment really, but more when the after treatment effects for me have been very long standing, and when I go in and see the doctors, I've got lots of questions about what's going on, all these different things, not least for example my voice, why is it like this, I hadn't expected that. So when I've got patients telling me about their problems before they've had any treatment, it makes you listen a bit more, because you understand that what they're saying mightn't be hugely, but to them it's really important. So I think I listen more. And something I'm really keen on, which is managing expectation, because I felt that my expectation was really well managed for the treatment itself, but for the after effects, which are long term, I wasn't prepared. I didn't realise how long. I assumed I'll be back at work 3 or 4 months most after treatment, and it was many more months before I could go back to work. So it's trying to manage patients' expectations. There is a price to be paid, and paying those little prices myself, it makes me more aware that all doctors, surgeons, whatever, need to make sure patients are fully aware of the immediate and the potential long-term. And yes, that's always been our duty, but I think I'm just a bit more aware of it. And the other thing is, which always been aware of, is patient choice. With cancer treatment, patients aren't going to say, oh, I don't think I fancy that actually, chemo sounds terrible. But I think it's important that patients are given the choice, not of yes of treatment or no treatment, and knowing what no treatment will be, but there are often other choices, and I think on the whole the teams, they agree at MDT what the right treatment is, present that to the patient. They may have other discussions about less appropriate treatments or less good outcomes, but sometimes I think the patient needs to hear about those. They may have fewer toxicities or poor outcomes, but not as, or poor outcomes, so the patient wouldn't want that treatment because they won't do as well. But actually, depending on where they are and what's important to them, actually that might be the right one for them. And I think often the MDT makes a decision, that's what the patient's told. Bearing in mind this patient is terrified, in a state of shock, they will nod and go away. But sometimes the patient will come back later and discover that another patient in another unit is having a different treatment. They think, well, that's very similar to mine, but subtly different, and I might like to have been offered that. So I think we do need to give patients choices, even if we think that surely they won't want that because the outcome is not quite as assured. Well, maybe they'll take that risk. Yeah. So I think giving patient choices is really important.
What would be really helpful is for medical students perhaps to learn what you would recommend or top tips in terms of how they practice going forward.
Treating the disease of cancer is what clinicians do it very well, and there are a lot of support services out there. But I think it's really important that not just the disease is treated, that the whole patient is treated, which might sound a bit vague, but the treatment itself is really important. But for me, what came after the treatment was far more difficult to deal with. And I think, although I did have support, I think there could be a lot more done to help patients with things other than just the treatment. So for medical students, you make a diagnosis, the patient's going to have a treatment, what happens afterwards? And with any long-term treatment like chemotherapy or a treatment that's going to have long-term implications, just reviewing the patient to make sure the disease hasn't come back is important. But equally as important is all the other things that are going on. The side effects of some treatments are so long-standing and can be devastating. It's really important to ask about those, not just have you got any signs of cancer. Head and neck cancer is a particular problem because there are so many side effects. Patients can have feeding tubes for months. They often get supported by dietitians. Patients can lose sensation in their fingers, which can make life very difficult for their jobs. I've got some hearing loss from treatment. It's really important that those side effects are checked on and supported, not in a sort of cursory way, because they will be bothering patients every day. And the commonest thing with head and neck cancer, dry mouth. They can't do much about it, but it helps if you're asked about it, and asked to rate it, how's it going, is it improving, and the odd tip along the way that clinicians are bound to know. So I think it's really important to ask about side effects and to make sure the patient is psychologically in the right place. Cancer diagnosis is very difficult. There is support out there. I think we underdiagnose the psychological and mental problems that cancer patients and their families have. I think if we could support that and do more about that, we would be doing patients a huge favour. For medical students starting off in their training and their careers, I would say you can't really give a patient too much information. It might take a long time, so that's why leaflets are so important. But if a patient's got all the information about their diagnosis, including things that might happen or what to do when certain things happen, it really empowers patients. It means they're less likely to come back to you or to the GP. So I think patient information is really important. And sometimes patients, I think, don't really look like they're listening. They don't really look like they want to know too much, or they say, oh, don't tell me too much. But the time will come when they've gone home, or their wife or their partner is going, oh, I don't know about this. That information comes out, it's hugely important, and it needs to be an ongoing feedback. And then, as I say, trying to see not just that disease, and it might be cancer, it might be another disease. That's the disease, but how is it impacting on the patient? What are the other things that could be changed to impact on that disease journey for the patient? It's kind of a lot. There's a lot of things there, but I think those are sort of areas that health professionals could look at if they really want to improve patient care.
Was there anything else that you might add?
It's really important as a clinician, as I've learned, to listen very carefully to what the patient's saying, to give patients time to give you feedback. You need to listen to that feedback. In some clinics and hospitals, they specifically ask patients questions when they're waiting in the waiting room. They have an iPad, or what are the questions you'd like to ask the clinician today? What would you like to ask about? And by asking the patients that, they can tick a few boxes, and then the consultant or the doctor can have a look and see what the issues are that the patient has thought about, rather than trying to maybe remember them in the heat of the moment. We need to ask them what their problems are sometimes. We need to prompt them, do you have problems with? And each specialty there will be specific things that they might bring up. And then I think if we can add information to the patient to empower them, to give them a bit of control over particularly long-standing disease, it's enormously helpful and positive to them to feel they've had a hand in the outcome.
Would you be able to let me know how you feel a charity like FORCE is able to support and help cancer patients?
There's so much more to a cancer diagnosis than just this is the cancer and this is a treatment. You don't realise when you're at the start of the journey, but there is a huge psychological impact. There are massive concerns you're worrying about when you'll get back to work, and will you be able to manage? Should you be going back to work sooner? What financial help is there in the way of benefits? And you're just worried about the cancer coming back and how your life's going to be affected. All these things have a huge part to play. They're hugely significant, particularly when treatment finishes. Cancer charities, particularly like FORCE, where they're so close to the hospital, they're just a little world away from the clinical, where everybody's sort of in a similar boat, whether you're a patient or you're a carer or a relative or friend. You know that everybody in there's there for similar reasons. It's just a lovely place to come to, and patients who are perhaps on long days at the hospital just calm and chill. Everybody's always really friendly, and I think that can be really important, maybe more for patients who don't have friends and relatives at home, but even for patients who are well supported as a haven. The possibility of just coming here and having maybe complementary therapy or some sessions and in dealing with life after cancer, the sort of practicalities, the worries and the psychological impacts that every cancer patient will probably get as they start to go back, but they perhaps don't realise they're going to face. Being able to prepare patients for those is just, potentially so important. The clinical teams do a great job, but they just can't cover all of that. I think it's important that the clinical teams, the doctors, the nurses, all the many specialists involved with cancer patients don't see the work of places like Force or other cancer charities as being in any way, I won't say a rival, but something that they ought to be providing, but they just can't. It's something additional, and it's in an environment which is very comforting and reassuring to patients. So I think it's important that clinicians and doctors recommend and embrace the things that Force can offer, because it is quite often something which just can't be done within the hospital.
Thank you very much for your time, Hilary. I'm sure this film will have huge benefits for medical students coming through, and I think it's really important to have the voice from somebody who's a clinician but has also had experience of a cancer diagnosis. So thank you very much.
You're very welcome, and thank you for giving me the opportunity to share some of my experiences and some advice.